Hi, my name's Michelle Gellis, and I would like to welcome you to today's presentation on facial acupuncture. A little bit about myself. I was on faculty at the Maryland University of Integrative Health from 2003 until very recently. And I have been teaching facial and cosmetic acupuncture classes internationally since 2005. I've been published in several different professional journals, including the Journal of Chinese Medicine, and also in Acupuncture Today. And I also edited a chapter in the Acupuncture Desk reference on cosmetic acupuncture. And I have presented at several different conferences around the country in the United States. Some of the classes that I offer, and all of these are continuing, approved for continuing education. They are my facial acupuncture certification class, a facial cupping and gua sha class, which is part of my certification or can be taken separately. I also offer a class on derma rolling and skincare, treating neuromuscular facial conditions, a class on the anatomy of expression, facial acupuncture self-care, advanced techniques in facial acupuncture, and recently I just released a class which is approved for safety CEUs on safety concerns when needling the face. The topics I'm going to speak about today are facial acupuncture and microneedling. Now, facial acupuncture includes cosmetic facial acupuncture and also neuromuscular facial acupuncture. Within the umbrella of cosmetic facial acupuncture, we have the actual facial acupuncture itself and facial cupping and also facial gua sha. Facial acupuncture is the fastest growing subspecialty in our profession right now, largely in part due to celebrities getting facial acupuncture and posting a lot of pictures on social media. And social media itself has done a lot to promote facial acupuncture, facial gua sha, and facial cupping. Unfortunately, there are a lot of bad social media posts that I see, things, techniques that aren't very good, too many needles, unnecessary too many needles, needles placed just haphazardly on the face, and sometimes people using needles in places that I would never consider using needles, like right into the red part of the lip, needling too deeply, or in many cases, in actual dangerous places like close to the jugular vein. I get questions a lot from both practitioners and from potential patients about facial acupuncture. This was a student of mine in one of my classes, one of the other students had done some cosmetic acupuncture on them. And as you can see, facial acupuncture really does not require this huge face full of 100 needles. It can be done elegantly, simply. The secret is precision needling. And when done properly, it can erase 5 to 15 years off of your face. As I started to say, I get a lot of questions about cosmetic acupuncture. People wonder if it's just some new trend that is going around, and facial acupuncture has actually been part of our medicine since the Song Dynasty. It's been around for a very long time. And it works with the qi, blood, body fluids, with the zong and the fu, because the way that I practice facial acupuncture is I incorporate body points into my treatments and work on a very deep level. I am a Worsley trained 5-element acupuncturist, so I'm all about treating the spirit. But also, if you think about the lungs, the kidneys, the liver, the spleen, the importance of keeping our internal organs, our internal systems working well in order to have good health in our face. It's very important. So it is wonderful for lifting the face and, again, treating on a deep level. Your patients are still going to look like themselves. They're not going to look all pulled tight and weird. I don't call it facelift acupuncture, but they will have a brighter appearance. They will look more well rested. It's great for some sagging and eliminating some of the fine lines, because when you use some of the smaller intradermal needles, you are creating collagen at the site of the wound itself. Cosmetic acupuncture treats the whole person. It's not just treating the face. And therefore, you're addressing some of the underlying causes of aging. The important thing when doing facial cosmetic acupuncture is to get properly trained and to be able to do precision needling so that you are affecting the areas and the organs that you want to affect. So some of the more common questions that I get asked are, how long does a treatment take? Well, that is largely dependent on the skill level of the practitioner, but typically the way that I practice, my patients are on the table for about an hour and 15 minutes. I spend about 15 or 20 minutes putting the needles in. Then I go and I treat another patient. Then I can come back in, take those needles out, do my cupping and gua sha, and then I can go back to my other patient. So anywhere from an hour and 15 minutes to an hour and a half, and I charge accordingly for my treatments. How long do the needles stay in for? Well, again, this depends on how long your patient is going to be on the table and how much time you have, how quickly you can put the needles in, but they need to stay in for a minimum of 15 minutes. Sometimes they'll stay in for as long as a half an hour. Does it hurt? Well, I can't stress enough the importance of using good quality needles, quality tools when you're working on the face, you should not be causing bruising, bleeding, pain. Bruising and bleeding can happen, but facial acupuncture, if done with very fine needles and a very skilled hand, should not be even as painful as body acupuncture. How long between treatments? You want to go treatments can be done as often as every other day, but typically I see patients once a week. It's not something where more is necessarily going to get you faster results. It's like it's like exercise. It takes time. Cosmetic acupuncture works with your body. And so it takes time for your body to build collagen and for you to be able to see results. Is bruising common? Well, this goes back to the skills of the practitioner. And typically, if I'm seeing 20 or 30 patients a week, maybe in the course of 3 months, one of my patients might bruise. And if you're using good quality needles and you study facial anatomy and you know what to look for and you understand the skin, you should not have issues with bruising. And if you do, they should not be very common. How many treatments? This is a big question that I get a lot. And it's definitely the number one question. How many treatments? And I tell all of my potential patients the same thing. And that is, I can give you a rough idea, but there's no way to know until I meet you and I take your pulses and I look at your tongue and I listen to your sleep habits and your diet. And age is important, but it's actually not the most important thing. Some of it is genetics and some of it is that your bone structure, and it all plays into a picture of how long will it take before you see the sort of results that you're looking for. And setting realistic expectations is very important. And I do go through this a lot when I'm with my patients, when I'm teaching my classes. So this was, another big question I get is, does it work? And so I had a patient a couple of years ago who had been seeing me on and off for years for neck pain, shoulder pain, various different things. She came to me for weight loss for a while. And she had picked up one of my brochures in my office on cosmetic acupuncture. When she first started coming to see me, she was in her mid-30s. Now she was in her late 40s. And she wanted to know, her eyebrows and her eyelids were drooping. She wanted to know if it could help with the drooping eyelids and eyebrows. And I said, well, go ahead and get on the table. And I just worked on the left side of her eyebrow and forehead. And I did some needling techniques with some facial motor points and submuscular needling, and helped to really lift up the whole left side of her face. And Once I was done, I handed her the mirror, and at first she looked happy and then she looked horrified. She said, well, I can't go home like this. Are you going to do the other side? And she ended up being a cosmetic patient of mine after that. This individual on the bottom was, she was an acupuncturist. She came to me. She had had a lot of grief in her life. She had been through a lot. I believe her dad, she was her caretaker for her dad as he was dying. And she said that her husband said she looked sad all the time, even when she wasn't. And I know that a lot of this has to do with the depressor anguli oris and the modiolus and all of the muscles that are attached in there. And she was an earth constitution type, so there was some of that. And she came to see me a few times, and I really started focusing on this area. And after about 3 treatments, you can see she's essentially making the same neutral expression. She's not smiling, but the way her mouth was turned down and this kind of sagginess all in this area had completely transformed, and she was thrilled. I mean, just look at this line right here compared to here. It was quite miraculous. So in addition to the acupuncture piece of cosmetic acupuncture, when I treat my patients, I always include facial cupping and facial gua sha. These were some pictures from some classes that I taught over the years. And I have a joke that I always tell. I say, your patients come for the acupuncture, but they stay for the cupping and the gua sha. It's very, very relaxing. And we're going to talk about that. So what are the benefits of adding the facial cupping and gua sha into your treatments? Well, facial cupping and gua sha will bring blood and qi out to the skin, and through the tiny little bits of microtrauma that are caused, it increases the fibroblast activity, which increases collagen and elastin production. Facial cupping and gua sha can release the tight facial fascia. You know, we use the muscles on our face a lot, and it helps to relax the tight fascial and reduce some of the adhesions. And this can help if there's any nerves that are entrapped in the tight facial tissue. It moves out stagnant lymph and fluids and toxins from the face and the neck, and is wonderful for reducing inflammation like rosacea. And it helps to strengthen the vascular integrity of the face. So over the years, I've always used glass cups, and but never could quite find a set that I liked that had where the rubber part was very easy to squeeze, but also gave me enough suction. And frequently some of the sets that I saw, I might like the cups, but they came in sets of 4, which I never knew what to do with the really big one and the really little one, because the 2 middle size were the ones that I used most. So I had a little time on my hands during the lockdown, and put together a set. So AccuLift, the AccuLift Derma Roller Company is my company. And I put together a set of 2 facial cups and 2 genuine jade gua sha tools in a set. And these are available on my website, aculifskincare.com, and you can open up a wholesale account. So any of the products that I talk about, and I'm just going to talk about a couple, but any of the products that I talk about, you can get on my website, aculifskincare.com. And the cups come in a set with instructions on the box and in the box, and there's also an accompanying video. So some of my patients have bought the sets, and then they enjoyed doing this on themselves in between treatments. These are a couple of before and afters. A student of mine in one of my classes had done some facial cupping, just kind of horizontally across the neck on necklace lines. We're seeing a lot more of these now. People have their heads down, they're looking at their phone, they're looking at their computer. So people are getting a lot more neck wrinkles, even at a very young age. And also, these are before and after treatments from facial gua sha that I had done on the forehead. So cosmetic facial acupuncture works on many different levels. It works on the skin level by stimulating collagen and elastin. It carries nutrients out to the cells. It reduces dark spots and increases blood flow to the skin. On a muscle level, it can help restore muscle symmetry, relaxes muscle tension, increases and enhances muscle tone, and can reduce wrinkles. As far as overall health, the way that I teach and the way that I treat is I do a full body acupuncture treatment. So it can create a deep relaxation in your patient, helps to regulate their hormones, improves their digestion, and just like any acupuncture treatment, it helps to enhance immunity. I mentioned that I'm a Worsley trained 5-element acupuncturist, and whenever I treat a patient, I always am thinking about their face. And the lovely late Lillian Bridges would say that facial work, whenever you're working on someone's face, it's trauma work. And what she meant by this is that all of our emotions show up on our face. So anything that's going on here, right, is going to affect anything that's on our outer world is going to affect our inner world, and anything that's going on in our inner world is going to show up on our face. And these expressions will be etched into our faces. So I took all of this information and my knowledge of facial motor points and 5-element acupuncture, spirit of the points on the face, and facial anatomy. And through all of this, I put together a course that I call the Anatomy of Expression. And I go through the different facial expressions and which muscles are used to make the expression, and how to use our tools to help to reset the face so that it isn't so constricted, and how these habitual expressions that have been etched on the face, how to work with those. And within that, also body points that correspond to different spirit points and maybe chi clefs, different points that can help to really affect the change within the organ systems and work with our emotions. Neuromuscular facial acupuncture is something that is not just a cosmetic learning. It is very important in our profession, especially now. The population is aging and people are under a lot more stress than ever before. So there are a lot more wind and heat conditions that people are subjected to, such as Bell's palsy and stroke, and people's immune systems are taxed. People are showing up with a lot more teeth grinding, like TMJ. Trigeminal neuralgia can also be from grinding your teeth, although it tends to affect the elderly more. Conditions like MS, ptosis, myasthenia gravis, and there are many other conditions. They're really quite well treated with what I use is the multifaceted approach. So when I have a patient with any neuromuscular facial condition, I use a combination of scalp acupuncture, facial motor points, submuscular needling, and facial cupping. And I've kind of wrapped all this into a class where the first day is all techniques and protocols, and the second half is all diagnosis and treatment planning. And these different techniques for different conditions, and I've had really wonderful results over the years with a lot of my patients. This was a student in one of my classes who had Bell's palsy many years ago, and she showed up, I think it was my Asheville class, and I was using her as my model. I was doing some cosmetic stuff on her, and she talked about her Bell's palsy and how she couldn't make certain facial expressions still. She couldn't like crinkle her chin, purse her lips together, do some, I think it was pouting. And I went through all of the different expressions with her, figured out which muscles were affected. And while she was on the table, I put a needle in for her MENTALIS muscle. And you can see it started moving. And then when I stimulated the needle, it really started twitching. So after that, she regained function of the lower part of her mouth again. I mentioned in this previous slide here, I mentioned submuscular needling. It's something very unique that I teach that helps bring blood and chi to different muscle groups. And this is an example of me needling the frontalis muscle. So when needling the frontalis muscle, the way that you isolate the muscle is you ask your patient to raise their eyebrows. Go ahead and raise your eyebrows, okay? And then relax. And you can find the border of the frontalis muscle. And the way that you needle is you're going to go
from the origin to the insertion. So the origin is up here and the insertion is here. And typically what I do is I will put in usually 3 needles on the lateral edge, and I will put in 2 needles on the medial side. And when you're needling, what's important is that the angle of the tube is the angle that the needle is going to go in. So if you go like this, it's going to go too deep. If you go like this, it's going to be too shallow. I use my thumb or a finger to help to guide the needle. So you want to keep your fingers out of the way when you're actually inserting. That way you can get to the correct depth right underneath the muscle. That's the lateral side. Then you're going to do medial side, and usually 2 needles will suffice. And I do the one side and then I do the other side. And I'm using 1/2-inch needles. You can use 1-inch needles depending on how big your patient's forehead is.
So, so by doing these sorts of techniques, you can help not only on a cosmetic level, but on a muscular level to get these muscles to function better, so that they are functioning more normally. So the next topic is microneedling, and I'm very excited. I've worked with my manufacturer, the same manufacturer that manufactures my Aculift derma rollers, also makes microneedling devices. And over the past few months, well, almost a year now, we've been working on a microneedling device. And a couple of months ago, I got my first shipment of Aculift micro pens. And so the pen comes in a case with 2 batteries, a charging cord, or charger, and also you can plug it in directly into the wall. If you have a very busy practice and you use up the batteries, each battery is good for about 4 hours. Comes with directions, and it comes in this nice metal case. The pen itself has nice bright LED readout, so you know what speed you are working at, and it's fully adjustable, the needle depth. So here's a picture of me doing some microneedling on some age spots on a patient's chest, and here are some before and after photos. I love microneedling for my patients that have a lot of sun damage or acne scars. It enables us to treat a large area of skin without having to use a lot of intradermal needles. Cupping and gua sha are great for rejuvenating the skin, but this works on a slightly deeper level. In addition to rejuvenating the skin, microneedling can help to regrow hair. And I was skeptical, but I worked on my own eyebrows for quite a while. I think I was doing it like every other week for a couple of months. And one day I went to put my eyebrow mascara on, like I always do, you know, my eyebrow pencil and then the little mascara. And I looked at myself and I thought, oh, I must still have some on from last night. And I took my makeup remover and I went to remove it, but there was nothing. I not only did my eyebrows get thicker, whoops, not only did they get thicker, but they got darker. And it's pretty miraculous. I have not been using it on my scalp, and I haven't used it on any of my patients' scalps yet, but when I go through my training, I go through how you would use the microneedling device on someone's scalp in order to help with hair regrowth. So what are some of the benefits of microneedling? Well, there's very little downtime. Your patient will leave the office, their face will be red, kind of like a mild sunburn. But there shouldn't be any bleeding. A lot of the pictures you might see on social media with all this blood, it's really very unnecessary. It's very low risk and it's very effective. The pen itself helps your body to produce its own collagen, so you're not putting anything in or taking anything out of the skin. It helps to reduce stretch marks. Let me move this out of the way. I don't know. So you can see the little LED readout when you press this button. It goes from 1 to 6 for the speed, and this is a close-up of the needle cartridge. It's great for stretch marks and age spots, acne scars, and wonderful for the neck and the chest area, which can be so hard to treat with acupuncture. It's not painful. I use numbing cream on my patients so they don't feel anything, but I've done it on myself without numbing cream. It's quite tolerable. The results last a long time. Once your patient has gone through a series of 4 to 6 treatments, the effects can last up to 5 years. And the treatments only take about 30 minutes from the time you put the numbing cream on until when you're completely done. And you can charge anywhere from like $300 to $700 a treatment. It just depends on what I would look into different medi spas in your area and see what they are charging and then price accordingly. So when you're looking at devices, since the efficacy of your treatments is going to be very dependent on the quality of your device, you want it to be a minimum of 14,000 RPM because the faster the needles are going up and down, the more little holes they're going to be able to poke, and it's actually a lot less painful for your patients. You can move the pen more quickly. And the AcuLift micro pen goes from 14,000 up to 18,000 depending on the speed. The tip, you want to make sure it has a bayonet connector, not a straight connector to go into the pen. The AcuLift has a triple bayonet tip with a triple locking mechanism. It has 3 holes that are used when you click the tip. I actually have one right here. Hold on one second. Okay. So this is what the tip looks like. And I don't know if you can see the It has three little bayonets going on, three little, it's like a clover. And it also has three holes that you see, one there, 2 and 3. So here is the pen, and getting a little glare going on. I'm actually doing this outside because it's so beautiful out today. But you just push the tip on and it clicks in, and then you turn it on, and whatever setting it was on the last time you used it, that is what it will turn on at the next time you use it. And then it has a dial here, and then you just dial up the, I don't know if you can see the numbers, but the depth of the needles. It's nice to have the versatility of either having the battery that screws off, or having it, using it corded. So you can take the battery off, and then there's a cord attachment, and really easy to, you know what speed you're using. There's no guessing. You just turn it on and it tells you what speed you're at. It comes with a 2-year warranty, and there is product support that comes with these pens, meaning you get marketing material and a web page and brochures that you can display. And also we provide a referral service. So if you buy a pen from us and you sign up for our Find a Practitioner page, that will go up on our website, so that if someone is looking for someone that we have trained, because the pen comes with training, they can find you on our website. There are other things that you might want to get when you get a microneedle pen, whether you get this one or you get another one, but you need supporting products like serum to use on the skin, and an aftercare product to send your patient home with. It's nice to have a tray. You'll need alcohol, makeup remover wipes, gloves, some numbing cream, tongue depressors to put the numbing cream on with. I like having a stand to rest my pen on. I don't think I have a picture of that. Oh, maybe I do in a subsequent picture, but here it is. Nice stand for it. Sleeves, disposable sleeves are great, and headbands for your patients, because when you're working, you want to make sure to work all around the hairline. So the AcuLift system comes with the metal box, the pen, the CEU training, 2 batteries. It comes with 10 needle cartridges, nano needles, and the 16 pen needles. Comes with a cord and a 2-year warranty. And it also includes in the system, it includes products for your back bar that you would use on your patients, 3 different serums depending on their skin type, an aftercare spray, and then a little patient take-home kit. My patients love these. They love having a little something to take home, but it has a serum, aftercare spray for that evening into the next day, and some face cream. It's CBD, arnica, pearl powder, and all of these products are vegan, organic, and made in the US. As I mentioned, you also get brochures and information for your webpage. So you don't have to go through all of that. You get patient information cards and a sample of a take-home kit for your patient. So I've talked a lot about cosmetic acupuncture. I've talked about microneedling. How are they the same? How are they different? Cosmetic acupuncture addresses the underlying cause of aging because you're going to be doing body points. It really gets to the root of your patient's concerns and any underlying issues with their lungs, their kidneys, their liver, causing liver spots, things of that nature. It also, cosmetic acupuncture works with the muscles and the fascia and with blood and chi, and it is great for sagging. It helps when you're working properly with precision needling, the face will lift itself. It's wonderful for the jowls and the eyelids. It typically people charge between $150 to $200 a treatment, and most patients will see some sort of results after 6 to 8 treatments, but they usually need a minimum of 12 treatments before they're ready to move on to maintenance. It is less painful than microneedling, but there's virtually no downtime. With microneedling, you're really just dealing with skin level issues, fine lines, scars. Working inside the orbital rim is something that you can do with the nano needles. You really can't do that with acupuncture needles. Those multiple lip lines, the microneedling devices are great for that. And sometimes your patients will see results after just one treatment, especially with dark spots. There is some downtime, usually that first day. I tell my patients to just take it easy that first day. Don't go out in the sun, don't exercise. And the treatments, you're going to charge a lot more for these treatments because you're going to be using these needle cartridges. You dispose of them afterward. You'll be using products, and they're going to come to you fewer times. So the similarities are they are both within our scope of practice, and both of them increase collagen production. So let's talk a little bit about training. I touched on some of my classes here and there, but what I want to impress is the importance of getting trained. So any good training course will go over things like contraindications, protocols, techniques, theory, anatomy, safety, the tools that we use, making recommendations for different sorts of needles, gua sha tools, intradermal needles, anything that you might put on the face to avoid bruising, those types of things. Skincare, most of us are not estheticians. Some of us may be, but most of us aren't. So, how do we talk to our patients about skincare? What do we know about skincare? Having some component of the class that is hands-on practice is very important. And marketing. Will they provide support for you afterwards? Do they have a marketing kit that they offer? Will they answer questions about how to get started? These are all important pieces in any good training program. And will they offer a CEU certification at the end? Because going through many, many hours of training is great, but there should be a certificate that you receive both for your insurance and for yourself to give your patients peace of mind. So these are some pictures from some of my pre-pandemic training classes. As I mentioned, I've been teaching classes internationally since about 2006. I think that's right. Maybe it was 2004. Anyway, a long time. And before the pandemic, I was doing very large classes around the country and around the world. And since the pandemic, I've started up doing, most of my lectures are online, but there is hands-on practice still. And now everyone wears masks. The classes are a little smaller. And as of the recording of this lecture, everyone is has to show a negative COVID test in order to come into class, since people will be exposing their faces, and or showing proof of vaccination. But it is now December 2021. This can all change quickly. Hopefully, we won't be living like this forever and ever. But currently, I have my students keep a mask on while all the body points are being put in and some of the face and head points, and the mask only comes off when necessary. And then once the needles are out, the masks go back on, and I require N95 or higher masks in my class. So I have a brand new this year, 1 year advanced certificate class. And the way it works is you can earn your basic certification along the way. And what that involves is 5 modules. They're all recorded lectures. And then you would move on to, so you would take my intake diagnosis, contraindications class, theory, protocols, Chinese face reading, skincare, telemedicine, cupping gua sha, derma rolling, and my advanced protocols. So that is my basic certification, which you can take all of it, you can take parts of it, and it's all recorded on my website, facialacupunctureclasses.com. Then you can move on to taking my neuromuscular class, part 1 and part 2, anatomy of expression, part 1 and part 2, facial acupuncture self-care. So that's so that you can do cosmetic acupuncture on yourself. I have a new course on safely treating the face, and that will earn your safety CEU. So this certification class carries 70, I think it's 75 NCCAOM, California, and Florida CEUs. There's also my microneedling class is part of it. And then the hands-on training, you have to complete 1 hands-on class, which is also approved for CEUs. So in addition to all of this, once a month, you have the option of earning additional CEUs by logging into a monthly 1-hour webinar. We do questions and answers, discuss a topic, and any sort of review. And this will go on throughout the year. And once you sign up, you have a year to watch all of these webinars. If you can't complete anything, you can extend it. And so that's what my advanced certification class is all about, and you will receive a really nice certificate when you're done. So I mentioned there are some hands-on training right now. I think this was from my Oakland class. Right now, I have a class, hands-on training. So it's a one-day hands-on training in Gainesville, Florida. Then I'm going to Scottsdale, then San Diego, up to Chicago in May. I'll be in Maryland. I'm going to make a decision this week whether what part of Maryland I'm going to be in. It'll either be Howard County or Annapolis. Then the end of August, I will be in Calgary. And then in October, November, and December, I'm going to be planning a class in New Jersey, and then perhaps up to Boston. I might go back out to the Pacific Northwest. It just will depend on what the pandemic is doing and how far I feel like traveling, but Boston and then back home to Sarasota. So I want to thank all of you for watching this webinar. If you have any questions, you can email me directly at michellegellis@gmail.com. You can also sign up to be on my mailing list on my website, facialacupunctureclasses.com. And I have a Instagram page. It is my first and last name. And I show a lot of weekly facial acupuncture tips there. And I also have a Facebook group called Facial Acupuncture, which has, I think there's about 8,000 acupuncturists in the group. It's just for acupuncturists. And I also show facial acupuncture tips there. So thank you so much for joining me. And I hope you found this useful and interesting.